Hi everyone, welcome to another episode of HolaDoctor, another live transmission. And today we're very happy because we're gonna answer a lot of questions about open enrollment, about health insurance, health coverage, and mostly importantly, the DACA, who can apply to the Obamacare. Is that right? We have Maribel Mercado from HolaDoctor. How are you today?
I'm good. How are you?
How you feeling so far on the open enrollment period?
I'm happy. It's almost done.
Almost over. When is the
Almost
last day?
over.
When is the last day they can apply to open enrollment for health coverage?
January 31st.
Okay, January 31st
Yes.
in New Jersey.
Yes, in the state of New Jersey.
Most of the states are the 15, right?
Yes.
Okay, so you have more than a month. Don't leave it until the end because it gets complicated.
It gets complicated. You
What?
leave it to the end, you're gonna have to, you may need paperwork, to put paperwork together and,
I see.
you don't want to be rushing and stressing at the end.
Perfect. So how are we getting into the point, Maribel? And we're gonna go with the first question, which is, what is open enrollment and why it's important?
Open enrollment, it's the annual period where you can apply for health insurance, renew your health insurance, um, or change your health insurance. And it's important because uh, outside of this period, if you don't apply during this time, you could stay without health insurance. So this is the best time to do that.
The new law that it passed, that DACA benefits can apply for Obamacare, for ACA. Can you tell us more about this? How did this happen? How can they apply for health coverage?
Yes, since November of 2024 now, DACA recipients are now eligible for to apply for health insurance, which is a big deal, right? For those that are DACA recipients, they have to apply now, so they don't stay with insurance for the year of 2025. So, if you apply now by January 1st, you'll have health insurance, and you won't get penalized at the end of the year of 2025 when you do your taxes.
Yes, and for most of them, this is their first time getting a health coverage. What can they expect? What benefits can they get, and how can they prevent, like you said, this to be penalized?
Um, well, they get the same benefits that I can get, right? So, and by the way, it's not called Obamacare no more. It's called the Marketplace. Um, so DACA recipients can access private health insurance through the Marketplace, and at Hola Doctor, we can help you to explore options because there's different plans within Horizon. So at Hola Doctor, we have experts, agents who can help you choose the best plan that's right for you,
Perfect. I was
depending
gonna
on your budget,
yes,
you know.
I was gonna ask you about that, about what can Ola Doctor do for them? How can they help um, for the first time in a health coverage plan? How do you help them?
They'll go, yes, they'll go over your budget. It depends on your budget and your family size. So they'll go over that with you, and they tell you, you sit with them, and it could be done over the phone as well. You don't have to come to the office. They'll go over the different plans, and they tell you according to your budget what is the best option for you, which one you qualify for and which one is better for you, because
And
you
it's
do have
important to say that
options.
it's a really quick process, that it doesn't get a long time. So you can get coverage like really easy with us, right, Maribel?
Yes, yes. And the process is only 15 to 30 minutes. The good thing is you apply today, by January 1st, you'll have coverage.
That's a good thing to know. You can start new year with the health insurance. That's good.
That could be your New Year's resolution.
Yeah.
And a lot of dreamers have been waiting for this moment. So this is a really good thing for them.
On the opposite side, what happens if I don't apply on open enrollment period?
If you don't apply during open enrollment period, then you could stay without health insurance. You might have to wait to the next time around, unless there is a special, what they
Event,
call it, huh?
a special event.
A special event, yes. A special moment, like you get married, you have a child, you start a new job, you lose your job, then those are special events. So unless that happens, you will have to
Yes.
wait for the.
I think another event is that if you move from different zip code or different area,
Oh,
or
that
you
also,
if you move
yes.
from another state to another state,
From another state. If
you
you come
have
from New
to.
York to New Jersey, then that's also a special event. Yes.
What benefits does health plans are available in New Jersey?
What benefits?
What benefits do health plans have available
Um,
In New Jersey?
doctor's visits, special like regular PCP, primary care physicians, um, specialists, what else? Telemedicine, a emergency room, prescription coverage. Yeah.
They're plenty. They're plenty. Once you get into the well, it's not more called Obamacare. It's what is it called? What
The
you say?
marketplace.
Marketplace. But there's plenty,
Yes.
and the mainly thing is that it's preventive care. I mean, you get
Oh, yes, preventive
vaccines,
care. Vaccines,
and
yeah.
all that care that you will have to pay for it.
Exactly. Yeah, vaccines are covered. Different prescriptions are covered. Asthma medicine, it's now like if you take an asthma pump, is zero copayment. Some of them are zero copayment. Depend and diabetes medicine also zero copayment, like the insulins. All that is covered.
Maribel, how do I know if I qualify for the subsidized or the financial aid that the government offers?
Well, when you sit with one of our HolaDoctor agents, once they put in your information, they would go over that with you, and they would tell you if you do qualify. It depends on your income. Those that are low income may qualify for that service.
And for that, what do I need to bring? Do I have to bring documents, my social
ID,
security? What do I need?
identification, like a driver's license and social security, proof of address.
And financially, what I need to bring so
Oh,
I
a
can
pay
put my
stub.
okay
Yes, a pay stub or
payrolls.
proof of, mm-hmm.
I see.
Yes, proof of income.
Perfect.
Correct.
How how long does the enrollment process take? Well, we covered that out.
Mm-hmm. Yeah, it takes a few days, maybe a couple of weeks. It doesn't take that long. You apply today, by January 1st, you have coverage.
Perfect. So what happens if I already if 2024 I had insurance? Do I have to renew it? Do I have to go with you guys so I can renew it?
Yes, it's
And
always
why is it
good to.
important? Why is it important that?
Yes, I was gonna tell you that. It's always good to check with your with your agent. If you're if you're active, if you're still active, because something could have happened. If you miss a payment, for example, you could lose coverage. Um, it's always good to check with your agent. You could either come into the office or call them over the phone and make sure that your insurance is still active, and also to see if anything, to provide any new documentation that you may have, like if your income changed, that may also change your plan. You know, you could probably get better coverage than the one you had last year. So it's always good to
It's
check,
always
always.
good to check that twice, double check that,
Mm-hmm.
because things happen throughout the year. The insurance changes, insurance plan change, and you can get benefit from, or you can get more benefits, and also you can get lower
Co-payments,
co-payments and all that, right?
yeah, or deductible. The deductible might change. So
So how do I
I
enroll? How do I
recommend that.
enroll with you guys? How can I enroll? How can I get in contact with you so I can enroll?
Oh, I don't have the number with me, but um, you can either write a message in the comment
On our
section.
social media.
Um, yes, here in on Facebook we have a lot of flyers with the phone number. You can also write to
Well, the
us.
phone number is it's appearing on screen right now, which is
Oh, it is on the screen.
it's
Great.
844 877 2567, right, Maribel?
2567. Yes.
Well, you can
And
also
we
visit us.
Yeah, you can visit us. We have two offices, in one in Jersey City, 353 Central Avenue, Jersey City. And we have one in Perth Amboy, which is 197. Sorry, that's the old one. 199 letter A Smith Street, Perth Amboy, New Jersey. And you can also visit us online at HolaDoctor.net. Here you can write a message on Facebook. We always have someone checking Facebook or Instagram. We everywhere.
Yeah,
LinkedIn. You
TikTok.
can always write a message, and
And
trust me, we'll
we
get
get
it.
back to you. Don't worry. And
Yes.
follow us on our social media and on our website also, because we have a lot of content that it's good. It's good health wise, because it teaches you good recipes. It teaches you good habits for a good healthcare. You know.
To stay healthy.
Yeah.
Yeah, like blood pressure,
And
new
also
baby.
you keep updated with the events that we have at the offices, so you can get benefit
Yes.
from that. You can get a free checkup and all of that, right, Maribel?
Yes, yes. Yesterday we had Santa in our office taking
Did you take a
pictures with the
picture with
kids.
Santa?
Yes, definitely. Yes, I did. I'm gonna send it to you.
Perfect.
It
So
will be posted on Facebook,
we're gonna
actually, all
post
the
the pictures
pictures.
on Facebook, so you can please give us hearts, heart emojis.
Yes, yes. Give us a lot of hearts and emojis.
Thank you so much. Do you have a last advice that you want to give, Maribel?
Well, my advice is to stay healthy. Make sure you're covered with health insurance is very, very
Yes.
important. And because you just never know, you know, one day you could be good, the next day you could be sick. And if you go to the emergency room with no insurance,
No.
they're gonna see you, but you're gonna get a big bill. And it's
With the
gonna
bill at
be
the end.
thousands of dollars,
No,
and it could stress you
we
out.
you have testimonies that they're still paying the hospital bill, right?
Oh yeah, there's people that they like, I think I'll finish, I'll pay for this bill. I'll probably, people say I'll probably die and still won't finish
It's
paying my
still
bills.
finish paying my bills. Oh my god.
Yeah, so
Yeah.
you have to just take care of yourself and make sure you get health insurance. And it doesn't hurt to stop by and check if you qualify or not.
Perfect. Thank you so much for those who connected to this live stream, and thank you, Maribel. Merry Christmas, Happy New Year,
Same to
Merry
you.
Christmas to
Thank you.
everyone.
Happy New Year. I'll speak
Stay
to you next
healthy,
year.
and
You too.
see you until next time.
Okay.
Bye
Bye
bye.
bye.